Good afternoon, everyone. Thank you for joining us. I will start, as I always do, with an update on the key statistics. As at 9 o'clock this morning, there have been 15,156 positive cases confirmed, which is an increase of 55 since yesterday. A total of 1,269 patients are in hospital with COVID-19. 849 of them have been confirmed as having the virus and 420 are suspected of having it. That represents a total decrease of 60 from yesterday, but it includes an increase of 4 in the number of confirmed cases. A total of 40 people as of last night were in intensive care with confirmed or suspected COVID-19, and that is a decrease of 4 since yesterday. I'm also able to confirm today that since the 5th of March, a total of 3,572 patients who had tested positive for the virus and been hospitalised have now recovered and have been able to leave hospital. Unfortunately, though, I also have to report that in the past 24 hours, 3 deaths have been registered of patients who had been confirmed through a test as having COVID-19, and that takes the total number of deaths in Scotland under that measurement to 2,273. That figure, of course, should be treated with some caution. Although deaths can now be registered at weekends, registration numbers on both Saturdays and Sundays are usually relatively low. So I would ask you to bear that in mind when considering today's figures. And I once again want to make the important point that these numbers represent unique and irreplaceable individuals whose loss right now is being grieved by many, and I want to send my condolences to everyone who has lost a loved one as a result of this virus. And let me also thank, as I always do and always will, our health and care workers. They continue to do an extraordinary job in the most difficult of circumstances, and my gratitude and the gratitude of everyone in the Scottish Government continues to be with them. Now, the main focus in today's statement is really to give you some advance notice of announcements and developments that you can expect in the week ahead, and also to emphasise once again very strongly why sticking to the current rules for now matters so much. On Thursday, as you know, the Scottish Government will formally review, as the law requires us to do, the current lockdown restrictions. And as we indicated last week when I set out the 4-phase route map out of lockdown, our current expectation is that we will be able to announce a relaxation of some of those restrictions. Initially, any relaxation will focus mainly on outdoor activities, and I would expect any new rules to start to come into force from Friday of this week. Tomorrow, we'll also set out more detailed information about how our test and protect system will work. That is test, trace and isolate. And tomorrow we will also publish our transport transition plan, which will provide detail about how public transport can operate safely while the virus is still in circulation. And that will include a clear expectation that people using public transport will wear face coverings. Both of those areas are, of course, very important and increasingly crucial as we start to ease some of the lockdown restrictions. Throughout the week, we will also be publishing guidance, which is currently being finalised with industry bodies, trade unions and public health experts for different sectors of our economy. And of course, in advance of the rules on social interaction changing in any way, we will publish clear guidance and what that means for you and how you interact with each other from, of course, a safe physical distance. So in summary, on Thursday, there will be a clear decision on whether or not we are lifting some restrictions and entering phase 1 of our path out of lockdown. And we will give you careful information as we go through this week about what rules are changing, what measures are in place to help you, and what you should be considering as you decide what you can and can't do in the days ahead. And let me be clear that any change to these rules is not yet in place, and I don't want people waking up on Thursday morning and assuming that they're in place straight away. If we assess that we are able to make this change and start to ease some of these restrictions, then any changes will start to take effect from Friday, and I will set out more detail of exactly what that timescale is on Thursday. Of course, regardless of what those changes are, our basic message for the next while will be to stay at home as much as possible. And although you will be able to interact outside and at a safe distance with other households a bit more, we still will want you to think carefully, very carefully, about the numbers of people you do come into contact with. Many of the current lockdown rules will still be in place, and it will be vital, just as vital, that everybody sticks to those. And I think it's especially important to emphasise that point today. I know that many of you will be feeling angry and frustrated about stories you've heard over the last couple of days and perhaps wondering why bother. I understand that, but I want to stress that as far as I'm concerned, the restrictions and rules that we put in place really matter. It's vital that all of us stick to these rules, and not just because people like me tell you to or ask you to. The reason we ask you to stick to these rules is because they help to protect you and your loved ones. They help us to protect our National Health Service, and they do help us to save lives. And in fact, it has been, I think, incredibly heartening in recent weeks to see that people across our country have overwhelmingly done the right thing. And I don't underestimate for a single moment how difficult that has been for many, many people. In this crisis, the way in which we have all shown love for and solidarity with each other is by staying apart from each other. And I know that many people, parents perhaps in particular, will have made very difficult decisions. Grandparents will not have seen new grandchildren. Parents will have struggled with childcare and no access to friends and family to support them. And many people have been denied the opportunity to say a final farewell to loved ones. The sacrifices have been tough, and many people will live with the pain of them for a long time to come. But these sacrifices have been for a purpose. It is because so many people have stuck to these rules that the number of deaths from COVID in Scotland has finally fallen over the past 3 weeks. The individual decisions that so many have made, which I know have very often been heartbreaking, have helped to prevent even more heartbreak. And I want to yet again thank all of you for that. But I also want to stress that even as we glimpse a possible end to some lockdown restrictions, following the rules that are still in place will continue to be essential. In fact, in many ways, that will be more important than ever. After all, as we start to lift these restrictions, there is a genuine danger that the virus will start to spread again a bit more quickly. So the way in which we ensure that doesn't happen, and the way in which we enable even more restrictions to be lifted in future, is to continue to follow whatever public health guidance is in place at the time. And an absolutely crucial part of the rules now and for the foreseeable future is about what we do if we have symptoms of COVID-19 or if members of a household have symptoms. If you think you have the virus, if you have a persistent cough, a fever, or a loss of taste and smell, you should self-isolate at home for a period of 7 days. In that time, you should get tested if you can. Testing is now open to anyone with symptoms. On the 8th day, if you don't any longer have symptoms, you can go back out. But anyone in your household should self-isolate for 14 days. That's to allow time to see if they develop the virus. And if they do, they should then isolate for 7 days from that point. And it is worth stressing, again, that self-isolation is not the same as lockdown. When you're self-isolating, you should not go out to the shops or go out for exercise or go to work at all. You should not leave your home for any reason. Indeed, if you need anything, you should have it delivered to you, for example, by family, friends, local volunteers or supermarket delivery services. And if you need to, you can call the national helpline that is in place to provide help. And the number for that is 0800 111 4000. If you're concerned about vulnerable people with you or vulnerable people that you care for, then again, you can call that helpline. Self-isolation is crucial. It is one of the ways in which we can stop the virus from spreading. And as we gradually emerge from lockdown, it will become more important than ever, particularly as we introduce, as we will at the end of this week, our test and protect system across the country. So if you or people in your household have symptoms, I ask you please to follow these rules because they do make a difference. And of course, for the moment, all other public health guidance remains the same. It applies to all of us and it is for the benefit of all of us. Please stay at home except for essential purposes, such as exercise, going to work essential work that can't be done at home or getting food and medicine. You can exercise more than once a day, but when you're out of the house, stay more than 2 metres apart from others and don't meet up with people from other households. You should wear a face covering if you can, if you're in a shop or on public transport, and remember to wash your hands regularly and thoroughly. And finally, as I've just covered, if you or someone in your household has symptoms, then you should stay at home completely. I know these restrictions have been and continue to be really difficult, but they are still essential. By sticking to them, we can help slow the spread of the virus, we can continue to protect the NHS, and we can and we will save lives. So thank you once again to everyone who continues to do the right thing. I'm going to briefly hand over to the Interim Chief Medical Officer to say a few words before, as usual, we go to questions, and obviously the Health Secretary is joining me today to answer the questions.
I want to talk briefly today about the importance of staying active. Now, more than ever, it's important we look after ourselves. One of the heartening things over the last few weeks has been seeing people in their households outside walking together, talking together during their time for exercise. Scheduling time to keep active helps you to manage stress and is essential for a healthy mind and body. Research shows that physical activity can boost self-esteem, energy, mood and sleep quality. And it's not just activity that's beneficial, it's also the lack of sitting. Breaking up the periods when you're sitting is just as important as exercise, as inactivity independently raises your risk of developing different types of disease. The coronavirus outbreak has changed daily life for us all in Scotland and has had a real impact on how many of us are feeling. There are some great tips to help get you through it on the clearyourhead.scot website, including tips on how to stay active. And something is better than nothing. Even getting out for a 10-minute walk around the block can boost your mood. The current guidance is that you can exercise outside as often as you wish. This can be an activity such as a walk, a run or a cycle. Exercise should be undertaken locally, and of course you should observe physical distancing rules, staying more than 2 metres from others, and exercise alone or only with your household group. But I'm afraid this advice doesn't include those who are in the high clinical risk groups or in houses where someone has symptoms of coronavirus. If you're in a household where someone has symptoms, you should continue to isolate. And as you get older, it becomes even more important to remain active to help to stay healthy and maintain your independence. Here, low-impact exercises focusing on strength and balance are the most beneficial. Walking, or if you're feeling more ambitious, maybe some yoga, are also good low-impact options. Break up the periods of not moving by changing where you're sitting, moving about, doing some chores, going outside if you can, but don't get stuck in one place. And if you're self-isolating because you or someone in your household have symptoms, or you're defined as extremely vulnerable on medical grounds, you shouldn't leave home. But that doesn't mean you should stop moving. It's really important to use movement and activity as a way of breaking up your routine, but only if you feel well enough. If you're unwell, use your energy to get better and don't try to be active. If you can get out of bed, then do so, but don't try to do too much. And for those recovering from feeling unwell with COVID-19, avoid strenuous activity as you recover. Start slowly and build up what you do over time. There's lots of exercise that can be done at home whilst we wait on gyms reopening. I know lots of you are feeling the absence of these. We're all adapting, and the internet is full of helpful exercise guides, online classes, and hints and tips to stay active indoors. For example, the free daily online PE lessons being provided by Joe Wicks on his Body Coach YouTube channel have been incredibly popular. Sports governing bodies in Scotland have reacted to the COVID-19 outbreak by creating really good quality online content that can help people stay active indoors and in their gardens. The NHS website also provides advice and fitness studio exercise videos that are suitable for all ages and abilities. The benefits of physical exercise are very clear. Many of you will have begun new patterns of exercise over the last few weeks, and I want to encourage you today to keep it up as an investment in yourself for the future.
Thank you very much, Gregor, and I'm sure many of us, myself included, would benefit from listening to Gregor's advice there. I'm going to go straight to questions now. Lindsay Bewes from BBC Scotland is the first question.
First Minister, thank you. You initially defended your Chief Medical Officer, Dr. Catherine Calderwood, and she went after sustained pressure. Would you admit you originally misread the public mood, and is the Prime Minister making the same mistake when it comes to his defence of Dominic Cummings?
Well, I've set out many times, as recently as this morning, my decision-making process there, and I'm happy to do so again before commenting on the Prime Minister's decisions. And of course, I have some insight into the situation he's dealing with right now. With the situation around Catherine Calderwood, I didn't defend what she had done. I made very clear, standing at this very podium, that I thought she had made a mistake in breaching those guidelines. And to be fair to her, she stood at that podium and also said that she had made a mistake and apologised profusely for that. And I think that perhaps is the first difference that we're seeing in these situations. I did make an argument that day, and I don't think it was an unreasonable argument, although one that didn't ultimately prevail, that yes, she had made a mistake, she had apologised for that mistake, but given the pandemic that we were dealing with and the importance and centrality of her advice, and remember, she wasn't a political advisor, she was the Chief Medical Officer of Scotland, then she should retain her post in order to continue to make that contribution. I made that argument, and I, to some extent, still regret that we lost the advice that she was giving. But when I realised that the public didn't agree with that, and that if we had continued with that, we would have risked undermining the public health advice, I came to a different conclusion later that night. And to her great credit, Catherine Calderwood came to the same conclusion. The conversation she and I had that led to her resignation, in that conversation she didn't try to save her own skin at the expense of the public health advice. She knew as a doctor how important that advice was, and I think that was to her credit, and I think she acted with great integrity there. So that's the process that we went through, and I'm very happy to set that out, as I have done many times. In terms of the Prime Minister and Dominic Cummings, my view is that they should come to the same conclusion. I don't say this with any relish. And people who have listened to me standing here day in and day out will have heard I have tried, because I don't think party politics has any place in dealing with this crisis. I've tried very hard not to indulge in that at all, be it I've been provoked or asked to do so in some of the questionings from time to time. But I do think there is a risk that political interest is taking priority over the public interest. And in a situation like this, it is so important that trust in the public health advice is maintained. And actually, it becomes more important as we go into later phases of this, because we will move from a situation where it's less the letter of the law that is telling people what to do and more guidance and appeal to people's judgment. And therefore, to have that trust in what we're asking people to do and why we're asking them to do it is really, really important. So, you know, the decision around Dominic Cummings is not for me. I've faced these decisions and I've set out clearly the considerations that were in my mind then. But I hope that the Prime Minister does reflect again on the situation and comes to a different conclusion to the one that he did yesterday. Susan Ripley from STV.
Thank you. If 2,000 contact tracers aren't in place by the end of June, can you be sure that it is safe for lockdown to start to be eased in these coming days?
Again, you know, this is something both myself and the Health Secretary have set out. We will have access to 2,000 contact tracers by the end of the month. That's what we've been working towards. We do not think we will need all 2,000 of those at the end of the month, given the levels of the virus right now. But it's really important that we have the capacity in place, and also that we have the ability to increase that capacity in future should we need it. I understand why people consider specific figures, whether it's 2,000 contact tracers or the 15,500 testing capacity we've set. That's important, but one of the most important things here will be to have a capacity that is capable of being flexed and potentially increased in the future. We'll set out more later this week about the Test and Protect system, the capacity we have in place for that, but also how it will work from the public's point of view, because this system will only work if all of us as citizens, know what is expected of us, both in terms of coming forward with the symptoms and isolating where we're advised to do so, and if we are prepared to do it. So building the knowledge of and understanding of that system is going to be really important. Neil Pooran from PA.
Thanks, First Minister. You spoke earlier today about the decision to discharge hospital patients into care homes before they had been tested, and you said that with hindsight, you would come to a different decision. Can you confirm if the Scottish Government will be having a formal review into this? And how big an impact it had on the crisis?
What I said in general terms this morning was, with hindsight, we may come to different decisions on a range of things. And that, I think that is true of anything, and it's particularly true of a virus that we didn't know very much about and have learned more about with every day that passes. I have no doubt there will be inquiries and reviews into every aspect of this crisis and how governments have handled it, and I think that is right and proper, both for scrutiny and accountability, but also to make sure we learn for the future, and care homes will be part of that. The point I was making is this one. It's very easy to apply hindsight right now and to say what we did then was, completely wrong, but if you think back to then, we perhaps didn't have many good choices, but we were in a situation where we had older people who were not medically required to be in hospital, were in what we call the delayed discharge category. And at that time, we were preparing for an influx of coronavirus cases into our hospitals. Now, take ourselves back there and you realise it would have been putting older people at significant risk not to have tried to get them out of hospital. And people talk about testing, and there are legitimate issues there, but of course back then there was a different view around the efficacy of testing people, not just care home residents, but people who didn't have symptoms. So we are applying a lot of knowledge now that we didn't have then, which is fine, but I do think we've got to accept that. What we did do at the time was put in place a risk assessment process for patients who were being discharged, and issue guidance, very strong guidance, to care homes about isolation and infection prevention and control there. What I take real exception to is anybody who suggests that we didn't act with real thought and care around older people in hospital being discharged to care homes. You may apply hindsight and say we could have done things differently, and it's perfectly legitimate for people to do that. But at every stage, we have sought to take the right decisions based on what we thought was the right thing to do to keep people safe. And we will continue to do that, adapting our responses as our knowledge of this virus continues to increase. Vivian Aitken from The Record.
Good afternoon, First Minister. I know you're going to talk about transport tomorrow, but if I could just focus on one part of it. You said the other day that people won't be confined to 5 miles to go and visit family and friends and to do exercise strictly. But is travelling those 5 miles restricted to people with cars, or will they be allowed to use public transport? Because at the moment, public transport is only for essential journeys. Will that then become an essential journey?
Well, I think what we're going to do tomorrow is set out the plan for public transport, how public transport can operate safely. So I know these things are all connected, absolutely, but that is separate to what we will set out on Thursday as we decide what restrictions are being eased and what the parameters around that will be. And obviously we're considering all of these things, and we'll set that out very clearly when we get to the formal review point on Thursday. So I think it's important that we do these things methodically. We need to continue to ask people to stay at home as much as possible, to continue to limit the number of people they interact with, but we also want to be a bit more flexible to allow people more social interaction and set logical parameters for that inevitably will ask people to apply some more judgment. But we'll set that out clearly with guidance around it when we come to that formal review point on Thursday. Christine Lavelle from The Sun.
Thanks, First Minister. You've repeatedly refused to release figures on hospital-acquired COVID infections and how many people have died after contracting it in hospitals. Is it the case that this data exists? And if it's robust enough to be used by the NHS, why can't it be made public with the relevant caveats?
I haven't refused to release any data. What I've said all along is that we will release as much data as we can, and when we do release that data, we want to make sure it is robust and reliable, and that applies across the piece. And we will continue to try to release more data as we can, and as much data as possible. And I think, in many respects, I think the data that we do publish in Scotland, it goes beyond and is certainly more up to date in some respects than other parts of the UK. So we will continue to seek to do that. Do you want to say any more there?
I'll just add a couple of points on that. I think it's really important. We will, as the First Minister said, release data as soon as we can, and are confident that it is robust data. But I do think it is important to remember that one of the issues around this particular virus is the incubation period for the virus, and so it is not straightforward to be clear whether or not someone who is in hospital who subsequently has COVID-19, where that was acquired, whether that was in their system and incubating when they went into hospital or not. And so that is part of what needs to be carefully worked through by those who work that through, clinicians, health protection, statisticians and others, in order to ensure that the data that is published is clear, not open to misinterpretation or misunderstanding, and consequently robust.
And that's a really important point, and I think any suggestion that we're refusing to publish data is completely wrong. We want to publish data that is robust and reliable, and that will be continue to be the principle that we abide by. Gina Davidson from the Scotsman.
Thanks. First Minister, the number of suspected COVID-19 cases in Lothian hospitals has risen from 52 a week ago to 187 yesterday, while all other health boards have seen a decline in suspected cases. Do you think this is a result of good weather that we've had in the last week? Is it lockdown complacency? Are you concerned that this will happen elsewhere when you introduce the easing? And what are your health experts saying about the potential causes for this difference in the Lothians area?
I'll hand over to Gregor in a second, who may want to add to what I say. I would caution, and I think at one of the briefings last week I made this point, I would caution against reading too much into the fluctuations in numbers of suspected cases, and that those who have been watching these briefings all along will have noticed that in the last number of days I've gone from giving an overall number of patients in hospital, combining confirmed and suspected, to now breaking that down into confirmed and suspected, because some hospitals and some health boards will categorise suspected cases differently. So if somebody, and remember we now test all patients over 70 going into hospital, so some hospitals may be counting anybody who's had a test as a suspected case until that test results come back negative. So confirmed cases are where we should pay most attention, but I think it's still important we give the figures around suspected cases. So I would just caution against reading too much into that. That said, of course, we continue to look at all of this data very, very closely. I do think that as we start to ease these measures, we will have to be very, very vigilant about any changes or fluctuation in the data. I read reports this morning, and I don't know how significant this is, of a hospital in Somerset that has closed its doors to emergency patients today because of an increase in coronavirus cases going to that hospital. So it underlines the point that I've made almost every single day. We've made real progress here, but we are not out of the woods on this. We are not through this pandemic yet. It is not over. And that means we have to continue to be vigilant, looking at the data, and all of us have to continue to comply with whatever rules are in place at the time in order to try to, as far as we can, continue to suppress the virus. Do you want to add, Gregor?
I would use just on caution in using suspected cases as a measure that it gives us as something that we should be tracking and following. I'd be far more interested in the confirmed cases, and if there was a rise in those confirmed cases prolonged over time, then that's something we would certainly be keeping a very, very close eye on. As the hospital system starts to gear up again, what we're starting to see, I've mentioned this a few times, we've urged people with other health conditions to seek help as quickly as possible. Some of the data that we're seeing certainly suggests that there is increasing emergency department attendances and increasing admissions for other reasons. And of course, some of these people will end up being tested as potential suspected cases for COVID-19 as well, just because they fall into one of the age group categories. So the fact that we're seeing a rise in that suspected number of cases, I don't think that we should read too much into at this point in time.
Mark McLaughlin from the Times.
Can you hear me?
Yes.
Yep, okay. My questions are around the Sunday Times reports on decisions in early March from yesterday, which I'm confident are accurate, but correct me if that's not the case. You've said if we knew then what we know now, we would have acted differently. Now, on the 2nd of March, Holland informed Scotland a night delegate tested positive. You were in contact with Holland at the time, presumably, to do contact tracing. Holland banned football and concerts on March 10, but Scotland didn't ban football and concerts for another week, so Stereophonics, Leverkusen, Six Nations all went ahead. What were you waiting for? Is it because you knew at the time people would get infected? And in the words of Jason Leach, that very day, Holland banned mass gatherings. You wanted to gradually, quotes, gradually increase the number of people infected over a very controlled period so that we get herd immunity. On March 3, teams from Imperial College and the London School of Hygiene told SAGE the mitigation measures could result in about 250,000 deaths. Did you see those findings that were presented to SAGE on March 3? And finally, I'm conscious that you're keen to keep all these questions for a public inquiry after the crisis, but decisions taken at the time are being used to justify decisions taken now. On May 7th, he said the reason you weren't following England out of lockdown was because, quotes, our first cases came later than England's, so we might be at a different and slightly later stage of the infection curve. Yesterday, we learned the first case in the north of England travelled down from the night conference in Scotland. So can you answer some of these questions for us today, please?
Look, there's lots of questions in there, and I'm very happy to methodically and systemically answer as many questions as I can. I have seen over the last couple of months and read more reports and such like than I can remember standing here. So I'm not going to get into confirming or not particular bits of paper or particular reports that I might have seen without being able to check that. Similarly, Health Protection Scotland, I'm sure we're in touch with health protection experts in Holland around that situation. I wasn't personally speaking to people in Holland. I've sought to take decisions that we have taken based on the best information and knowledge and applying the best judgment to that at every single step of the way. It has never been my view that we should simply let people get this virus. All along, saving lives has been one of the core objectives that we have set. And I'm not trying to dodge these questions and saying that properly and in the fullness of time, all of these things will require to be considered and looked at. But, again, I would make the point that we are not through this yet. And I still have to focus on trying to do the very best things and take the best decisions to get us through the remainder for however long this will be of this health crisis. And that is what I'm going to continue to do. I don't, as I think my sternest critics would say, I don't shy away from scrutiny. I stand up here day in and day out and answer questions, and I will continue to do that, no doubt, for the remainder of this crisis and well beyond that, no doubt. But I also have to keep focused on taking the decisions that people in Scotland have a right to expect me to focus on, because we are not yet at the end of this crisis. Derek Keeley from...
With Jason Leach at the time, because you said it wasn't your view that you wanted to gradually increase the number so that we get herd immunity, but that was Jason Leach's view on March 10th. And you were following the science.
People will have made comments about what will happen in the course of a virus. That is a very different thing to saying it was a policy objective of the government. And I make the point repeatedly that we have learned, not just in Scotland, every single country in the world has learned about this virus. We've learned many different things that perhaps make us view certain things differently now to how we viewed them then, and that is the same in every country. All of this is really legitimate, it's really important. I as much, if not more than anybody, want to make sure that all and every appropriate lesson from this is learned for the future, because unfortunately there will be pandemics in the future. I hope not for a long time. So learning these lessons is really important. But so too is making sure that we continue learning as we go, making the best decisions for the steps that still lie ahead of us. And that is what I'm going to continue to do, answering questions day in and day out as I do it. Derek Keeley from the P&J.
Thank you, First Minister. Just to come back in on Neil's question on care homes. Again, you said that with hindsight you may have come to a different conclusion on sending untested hospital patients into care homes. That would suggest the decision taken at the time was not the correct one. Many families will wonder if their loved ones may have survived this crisis and a different route had been taken. Do you owe an apology to families?
Look, the point I've made, trying to be candid and open as possible here, is that on a whole range of things, if you had all the knowledge then that we had now, we may have taken different decisions. I'm not saying that specifically in relation to the particular issue you talk about. I'm making a general point that when you're dealing with a virus that is still 150 or something like that days old, that was a new virus that none of us knew about the way we do now, then yes, of course, you have to act on the basis of the information that you have. But again, I come back to a point that I've made previously, but it's a really important point, that if we had left older people that didn't medically require to be in hospital, we would also have been putting them at significant risk. And I think families would have rightly been concerned about that. We took the best decisions based on the best information we had, and we put in place precautions as we did it. Patients who were discharged from hospital to care homes were risk assessed, clinical assessments were done of them, and guidance was given to care homes about how to manage residents in this situation, including isolating residents, not having communal eating or communal activities, and what they should do to ensure infection prevention and control. So at every step of the way, we have sought to do what we consider best to protect older people. And as we learn about this virus, we have, as we've stood here many times talking about, from testing through to our public health approach to care homes, we've adapted that as the knowledge has suggested that we should. And we will continue to do that. There is no aspect of dealing with this that doesn't every single day weigh heavily on me and the Health Secretary and all of us. These are the most vital issues that certainly I've ever had to deal with, and I take great care and apply as much caution to all of this as possible. But, as I say again, taking knowledge that we have now that we didn't have then and simply applying that back is easy to do, but unfortunately you don't have that hindsight when you're making these judgments. Simon Johnson from The Telegraph.
Downing Street has announced that Dominic Cummings is to make a statement later today and to take questions as well about his movements. What do you think? What would you like to hear him say to the British people?
Perhaps, concede that he made a mistake, that he didn't follow the rules, and instead of trying to retrospectively rewrite those rules, to admit he made a mistake and apologise for that. That aside, there are lots of detailed questions about his account and the account that was given afterwards by his wife of his isolation that don't, to me, seem to tally up. But I'm sure there are many journalists who will put those questions to him. So, but I think a simple recognition that in saying, and I think for many people hearing the Prime Minister last night say that he acted appropriately and following the instinct of any parent, a lot of parents will have heard that as suggesting that by following the rules, they didn't act like good parents. And I think that is really, really unfair, and perhaps correcting that suggestion and that impression would be something that he should consider doing. Alistair Grant from the Herald.
Hi there, thanks very much. Just to go back to the issue of care homes, I think there's still a few questions I don't think we've had answers to, such as how many of the 921 patients who were moved from hospitals into care homes in March were first tested for coronavirus, how many of the patients entering care homes were subsequently found to have the virus, and how many enter facilities where there were outbreaks of COVID-19. I think the Health Secretary has confirmed that Public Health Scotland does hold some of that data. When exactly can we expect it to be made public? And just as well, if I could quickly ask, if the Scottish Government has access to 2,000 contact tracers, but have not hired that many themselves, are we relying on contact tracers in England?
No, absolutely not. And we'll set out more detail of Test and Protect, but that is not the case. The point I am making here is we will have the ability to have 2,000, but we will probably not need them. So they will not all be required to work as contact tracers from day one, but we will have that resource, and we'll set out more about that. But the point about England is emphatically not the case. In terms of the data, it goes back to the point we made earlier. We want to publish as much data as possible. We have to make sure that data is robust. Some of this data takes a bit of time to gather and to quality assure to make sure it is robust, and we're in the process of doing that with a whole range of different things, and we will publish as soon as possible to the extent that we are able to. Do you want to say any more about the specifics?
Just to add a couple of points, I answered this question, in fact, yesterday. So Public Health Scotland needs to bring two databases together, in effect. One is about the discharge database, the other is the testing database. Now, that is not as straightforward as it might appear from what I've said. You need to ensure that the way the data is collected in those respective databases is possible to marry it up. You need to then double check that you've not missed anything, you've not double counted, that you are comparing, if you like, apples with apples. That's all that robust work that needs to go on. And as we've said we will publish this when Public Health Scotland have undertaken that work. But we've also consistently said that the point about transparency is to publish data that people can rely on. That means it needs to go through those careful processes before it is published. That's not something that I do as the Health Secretary. It's not something the First Minister does. It's something that those clinicians, statisticians and others in Public Health Scotland and elsewhere undertake in order to ensure that it meets their professional standards. And once they have done that work, we will publish it.
Also, when we do, it is the point we make about not applying knowledge now to what happened then is really important. I think the first part of your question around this was data about how many were tested, and we'll publish that data as and when we can. But remember, back then, there was even more doubt than there is today, and there is still some doubt today about the efficacy of testing people who didn't have symptoms, because there wasn't the same understanding back then about asymptomatic transmission. And as I say, there are still doubts about the reliability or the relative reliability of the test in patients who don't have symptoms. So all of these things, I think, it is important to bear in mind. Tom Martin from the Express.
Hi, good afternoon. Thank you, First Minister. Just if I may, just to clarify on contact tracers. So from what figures that were out this morning suggest 660 are currently in place or ready to go by the end of this month. Can I just to understand why you think we don't need the 2,000 that was the original target in place by the end of this month?
Can I just say, we are not dropping the 2,000 target. That is still what we are aiming to do and on track to do. So just let me be clear about that. But basically, the number of let me take you through this step by step. What are contact tracers there to do? They are there when somebody comes forward with symptoms and is either assessed as being very likely to have the virus or test positive. Then contact tracers assess who they've been in contact with all the definition of what a contact means, and then they trace those contacts and give them advice about isolating, and where they have symptoms, then refer them to test. Now, that means that how many contact tracers you require is dependent on the number of people you are likely to have getting the virus and coming forward with symptoms. And our assessment of the prevalence and incidence of the virus right now would suggest we will not need all of those 2,000 contact tracers right now, but we may need them in the future. We may need more than that in the future if the virus was to start to transmit more and more rapidly than it is doing right now. So this is not a fixed number that will be constant right throughout. We're trying to control a virus here. So the resource you have to do that has to be flexible, and it has to adapt depending on the state of the virus and the risk that it is posing at any time. And I think that's really important to bear in mind, so that yes, these figures we've set that we're aiming for, it's important to be held to account on reaching those, but don't get too fixed on a particular number, because we may need more than that in the future, and there will be times when we don't need all of the resource that we have at our disposal. The flexibility of this system will be one of the things that is most important about it. Michael Blackley from the Mail.
Hi, good afternoon. Just return again to the issue of the 921 patients discharged from hospital into care homes. You were specifically asked about that issue this morning, and your exact words were, if I apply hindsight, that I'd come to a different conclusion. So assuming that you haven't changed your mind on that since this morning, can you just explain what has led to you coming to that judgment? Do you now believe that there may have been patients who went into care homes, contracted the virus, and subsequently died as a result of being discharged from hospital?
Well, I cannot say that for certain. I'm sure that is one thing we will want to absolutely look at and ask very serious questions about. But equally, nor can I absolutely say that will not be the case. What I said, and sometimes it feels a bit like, politicians like me are sort of penalised for trying to be open here. We're dealing with a situation here right now that has a lot of uncertainties in it. That's been true from day one, and it will continue to be true. And I'm trying to be honest about some of the implications and consequences of that. And that means on a whole range of things, not just on this issue. It may be that we would, if we could wind the clock back, we would take different decisions. But that doesn't mean that we would, because I cannot foresee the circumstances in which we would have concluded that it was right to keep older people who didn't medically need to be in hospital while hospitals were filling up with cases of this virus. And I suppose what I'm saying is, when you deal with something like this, there are no perfect options available to you. You have to do what you think is best based on the knowledge you have at the time, and that's what we sought to do. We didn't do nothing to try to protect older people. We put in place a risk-assessed approach and guidance for care homes. Now, yes, there may have been different things we would have looked at had we known different things, but at every step of the way, we seek to do what we consider best with the protection of people absolutely foremost in our minds. And that, I'm afraid, is I would rather be dealing with a situation where there were hard certainties at every single stage. It's a lot easier to do. But that's not the situation that we have faced here, and it's not the situation we are facing now with this. As we go through the next weeks and months, I am sure there will be knowledge that transpires, that changes what we know about this virus right now. That's what makes it so challenging for those who have lost loved ones. That is, I can imagine, horrendously difficult to come to terms with. And my heart breaks for everybody who's lost a loved one as a result of this virus. And the assurance I can give them is, just as we have done from day one, we will continue to do the very best we can to protect people. And one of the things we have to do over the next period is make sure we don't act too quickly in lifting lockdown restrictions and allow the virus to run out of control again. Paul Mallock from the Courier.
Good afternoon, First Minister. If we're going to implement a test, trace and isolate across all symptomatic patients in Scotland, presumably we'll need to use self-swabbing and army support at testing centres. What training is being offered to ensure that good quality swabs are being carried out by known health professionals to avoid any false negatives? And are there plans to expand testing centres to allow for an influx in the number of tests that are going to come in?
Well, the testing that will be done will be through a range of different routes. I'll hand over to the Health Secretary to say a bit more in a second. It will be through the drive-thrus, it will be using mobile testing, it will be using our NHS testing capacity, not the processing lab capacity, but the capacity to actually take the tests. And there will be a role which may increase over time for home testing, although that's still relatively small part of our capacity right now. And we will want to provide this as locally as possible for people, but also make sure that it is as rapid as possible. We'll set out more details of all of this over the course of the week, as we will set out details, which is actually the really important bit for the public, as to what the public should do if they are symptomatic and coming forward for testing.
Just on the point about where people would get testing, because we're very conscious that we need to make this, because this will be such a central part of everything we are doing for many months to come, that we're very conscious that we need to make getting the test as straightforward as possible, particularly because individuals will be getting the test because they have symptoms which may be coronavirus and they may be feeling unwell. Some won't be feeling unwell but have the symptoms nonetheless. So we're actively looking at all the ways by which we can ensure that getting the test, having the sample taken, is as close to your home as it possibly can be. And some of the detail of that will be set out tomorrow, as the First Minister has said, and we will continue in an iterative way to improve on that as we go through the weeks ahead.
Terry Murden from Daily Business.
Good afternoon, First Minister. Regarding getting people back to work, I wondered, is it still necessary to distinguish between essential and non-essential work? Surely the test now is whether each workplace has the desired health and safety precautions in place, whatever type of work they're doing. We've got many house builders, for instance, which say these measures are in place and they're ready to go. Yet you're asking them and thousands of home buyers to wait possibly another 4 weeks to restart. And some house builders say they just won't survive that long. And if supermarkets and food factories can work safely already, then why can't other factories and research labs, which already have high health and safety standards, and these are also being asked to wait?
Well, part of the process we're going through now across 14 different work streams is putting in place the guidance sector by sector that allows safe reopening of workplaces. I think it's really important to do that methodically, and it's really important to do that in a way that has employer and worker and trade union assurance around it, so that there is confidence in people going back to work. So that's exactly the process that we are going through, and some of that guidance will start to be published over the course of the next few days. In terms of construction, the construction sector has actually prepared its own, I think, 6-phase restart plan, and in the route map that we published on Thursday, we gave the go-ahead to the implementation of phases 1 and 2 of that. So this work is underway. But I come back to a key point here that I think it's really important that we don't forget, is that we still have to, in order to stop this virus running out of control again, we still have to try to limit the interactions between people. And as we slowly start to ease those restrictions, make sure that it's been done safely. So I want to make sure that as we get people back to a degree of normality, individuals and businesses, we are doing that in a way that is not taking too big a risk, because there is no risk-free way of doing this, too big a risk and resulting in the virus flaring up again. Tom Magner from Carers World.
Thank you very much indeed, First Minister. A slightly different question. Your government has announced that Scottish unpaid carers are to get a one-off £230 bonus to help meet extra costs. I believe it's called the Coronavirus Carers Allowance Supplement. What's your message as First Minister to other First Ministers and to the Prime Minister to persuade them to cut through political considerations and make this same gesture?
Well, I think it would be very good if others were to consider this, although everybody has to make their own considerations and reach their own judgments, and that's perfectly valid too. Of course, in Scotland, we already have the Carers Allowance Supplement, which is our top-up to carers allowance. So this is a top-up to the top-up, if you like, recognising that for many unpaid carers, dealing with the challenges of coronavirus will have been very, very difficult. So it's our way of recognising those practical challenges, but also our way, which I'll do right now again, is to say a heartfelt thank you to unpaid carers at all times, but particularly now with the added difficulties that they are facing. And this is a small way of recording that thanks, but it is one that is very much meant sincerely by the Scottish Government. Charles Fletcher from Caledonia Media is the last question. I'm being told Charles is not on the line. So that concludes the questions that we have today. Thank you to the journalists who've joined us. My thanks to Gregor and Jeane, and to Jill, our BSL interpreter for today. And thanks to all of you for joining us. We'll be back tomorrow at the same time of 12:30 with more detail on Test and Protect. There will be statements in Parliament over the course of tomorrow, including on the public transport guidance. And as we go through this week, of course, we'll continue to be very clear about the lead up to Thursday and the easing of some restrictions and the guidance that we'll be putting in place to try to give you as much information about that as possible. But for now, thank you for joining us, and I look forward to seeing you tomorrow.